Hi, my name is Marley. I'm going to be doing a simple assessment on you today. Can you give me a fake name and a fake date of birth?
Jane Doe to 1278.
Perfect. First thing I'm going to do is feel your head. Make sure that everything's symmetrical. Make sure there's no bumps, no nodules, no bony prominences. Everything feels good. Next thing I'm going to ask you to do is smile for me, frown, puff out your cheeks. Perfect. I was just assessing cranial nerve number 7. Next thing I'm going to do is I'm going to use this tongue blade. I want you to look straight ahead, close your eyes. What I'm going to do is touch your head with this. You tell me if it's sharp or dull.
Dull. Sharp. Dull. Sharp. Dull.
Perfect. That was assessing cranial nerve number 5. Next thing I'm going to do is feel your temples. Make sure that the pulses are equal, that they are +2, they're palpable. I'm going to listen and make sure that there are no bruits. Okay. Good, no bruise, no frills. Now I'm going to ask you to stand up. We're going to take a look at our Snellen chart over here. There's a mark on the floor that indicates we're about 20 feet away from it. So go ahead and cover one eye for me and try and read the smallest letters that you could read.
L-E-F, O-D, D-C-T.
Okay, now cover the other eye. And try again.
D-Z-P-O-L-E-F.
Okay. You can have a seat back here again. Alright, now I'm just going to take a look at your eyes. Make sure that your sclera is white. I'm going to pull your lids down a little bit. Make sure there's no bleeding, no pus. Everything looks good. There's no swelling. Now I'm going to take my pen light. Alright, I'm going to put my hand on your face and look into your pupils. Okay, both of them are round. They're equal, they're reactive to light, and they accommodate. Now I'm going to check cranial nerve 3, 4, and 6. I'm going to use my pen light. I want you to follow the tip of it. Okay. Good, no nystagmus, nothing like that. Now I want you to squint your brows and squint your eyes, raise your brows up high. Good, that was testing cranial nerve number 7. All right, now I'm going to use my ophthalmos scope. Okay. First thing I'm going to do is set it at a 0. I'm going to go about an arm's length away from you. I'm going to check for a red response. Perfect. Okay. I'm going to come a little bit closer. I'm just going to look in your eyes. Okay. Other one. Okay. Alright, now what I was looking for there was to make sure that your retina was a red-orange color and that your vessels were good, they were red. Alright, now I'm going to switch this up. We're going to look into your ears. So first I'm going to feel them, make sure that there's no nodules, no scars, everything looks good. Shape looks good. I see you had your ears pierced at one time. Okay. I also wanted to feel your mastoid. Make sure there's no big bumps or nodules or anything like that. Alright, now I'm going to take a tip here. Take a look inside. I'm gonna make sure that there's no pus, no drainage. I can see your tympanic membrane. It's a pearly gray color. Do the same thing over here. No swelling, they don't look irritated at all. Alright, now what I'm going to do is I'm going to test your hearing a little bit. I'm going to stand behind you and whisper a word. Once you hear the word, just shout it out for me. Alright? Baseball.
Baseball.
Okay.
Apple.
Okay. Good, that was testing cranial nerve number 8. Alright, now I'm going to take my tuning fork and I'm going to do 2 tests. One is called the Weber test and one is called the Rhine test. So the first one, I'm going to take this, I'm going to hit it, it's going to make a noise. I'm going to put it on the top of your head. You tell me if it's better, if you can hear it better on the right side, the left side, or both. Okay? Oh. Oh. Okay. It's got a good one. Okay.
Oh.
Okay, cool. Now this next one, I'm going to hit it again. I'm going to put it by your ear and then behind your ear. You tell me which one is better, okay?
Side.
Okay. The other one?
Side.
Okay. Good. All right. How are your sinuses? Are they okay?
Pretty good.
All right. I'm just gonna have a feel. Tell me if there's any pain, any tenderness, anything like that. Good. Okay. Now I'm gonna take a look in your. First, let me do your nose. Having any breathing problems?
No, not lately.
Okay. Just gonna look up very gently in there. Make sure there's no redness, no bleeding. I can see your tubercles. All right, I want you to cover one side of your nostril. Yep. Can you take a deep breath? Perfect. Other side. Awesome. Now I'm going to take a look in your mouth. All right, open up wide. Okay, say ah.
Ah.
Okay, lift your tongue up, down, to the sides. Okay. Let me see. I'm gonna put my hand here. Press your tongue up against my hand. Perfect. Perfect, so your tongue is good. That was testing cranial nerve number 12. Now I'm gonna test cranial nerve number 5. I'm gonna feel back here. I want you to clench your jaw. Okay, good. Now I'm going to feel your lymph nodes. Just make sure there's no swelling, no nodules, nothing like that. Okay, even up into here. Okay. All right, now I have a little cup of water here. Just want you to take a sip. Make sure that trachea is nice and midline. Perfect. Now I'm going to check out your carotid arteries. First I'm going to feel. Okay. Feel one at a time. I'm going to listen. Making sure there's no thrills, no bruise. Now I'm going to check cranial nerve number 11. I want you to shrug your shoulders against me and turn your head against me. Perfect. Can you look to the right, look to the left, up, down? Good, your range of motion's good. I'm gonna have you, do you have any more water in there? Okay, first I'm gonna try and feel for your thyroid. Okay, go ahead and take a sip. Perfect, so it went up, back down. Feels about normal. Normal size is about 4 to 6 centimeters. Now, I'm gonna listen to your back. So if I could have you swing over, try and give the camera a good view here. Move your hair. So first, I'm going to just watch you take a deep breath. Okay. Everything feels good. All right, now I'm gonna listen, okay? So we're good, nice and clear, no crackles, no bronchi, none of that stuff. Now what I'm gonna do is put my hands on your back and I'm gonna occasionally move them down. Every time I move them, I want you to say 99, okay?
99, 99, 99, 99, 99.
Okay, good. Okay, now we're gonna go switch to the front. So we're going to do the same thing. We are going to watch you take a deep breath.
I'm about to die.
What? Okay. All right. First, we're going to watch you take a deep breath. Okay. I'm just going to feel you, make sure everything is good. All right. Now I'm going to listen. Okay. Perfect. We're gonna go again with the 99 thing.
99, 99, 99.
Okay. Okay. Now I'm gonna do this thing. I forgot one thing. Can you swing back over for me? It's called percussion. So what I'm gonna do is just kind of tap on you. Okay. Oops. All right, and let me just make sure I get a good listen to your sides. Now while you're there, I'm just going to measure you. So they say that your side should be about half of the length of your back, which is good. All right, now I'm going to pull this, here, I'll take water. I'm gonna pull this out, have you lay down for a quick second. Perfect. Take a listen to your heart. Are you okay? Okay. All right. I'm gonna have you lay on your left side. We'll do the same thing. Okay. You can go ahead and sit back down. Alright, I'm going to take one more listen while you're setting up. Can you pull this out a little for me? Thank you. Alright, so what I was looking at while you were laying down was just to make sure that your jugular veins weren't distended, anything like that. I was listening to 4 main points in your heart: the aortic, the pulmonic, the mitral, and the tricuspid points. Everything sounds good. Just a clear S1, S2, no artifact sound, nothing like that. So I think we're good. And then when I was tapping on you, I just wanted to make sure that all the sounds were pretty much dull. Over your lungs, there were some resonant sounds, which is pretty normal. Just making sure that everything's good. And I think that's all. All right, thank you.